I recognize the member for Nepean. Would the member for Niagara Falls please come to order? I apologize. The member for Nepean.
Thank you, Madam Speaker. Speaker, my question is for the Minister of Health. I have heard over and over again from this government that they have made a world-class healthcare system. And here's what this world-class healthcare system looks like. 30,000 people in Nepean don't have a family doctor. Emergency rooms are closing. People are dying while waiting for necessary surgeries. Urgent care clinics are turning patients away even before noon. A constituent told me that it took him 18 hours to get his newborn son seen at the hospital. When I toured a hospital recently, I saw signs taped up on the walls besides the beds in the hallways. Hallway bed 1, hallway bed number 2, all the way up to 10. This is not dignity. That's not care, and it certainly is not world-class. So, Speaker, will the Minister of Health stand up and truly continue to call a world-class healthcare system, knowing that this is the reality?
Good question.
I recognize the Minister of Health.
Speaker, I absolutely 100% will say that the clinicians who work in the province of Ontario, in our hospitals, in our long-term care facilities, in our community centres, in our facilities across Ontario are providing world-class health care. Now, I look at the expansions that happened last year in February of 2024, and in Ontario Health East Region, we have Upper Canada Family Health Team, an additional 6,000 patients connected.
Whoa.
Ottawa Nurse Practitioner-led Clinic, an additional 6,000 patients connected. Perth Family Medicine Family Health Team, an additional 3,500 individuals connected. Kingston Community Health Centre, otherwise known as Periwinkle, 10,000 patients connected. I could go on and on because, of course, there were 78 expansions. And that's not all, Speaker, because, of course, in the coming weeks and months...
Question. I recognize the member for Nepean.
Thank you, Madam Speaker. That was a lot of words to not answer my simple question. I'm a nurse. I've worked in long-term care, and I will never forget one day when a patient grabbed my arm and said, "Get me out of here," because I feel like a trapped animal. That's the system that you're here talking about.
That's your system.
You've had this government.
Education will come to order.
This government has
member
had.
for Windsor West will come to order.
Have some accountability.
Apologize to the member. The Minister of Education will come to order. 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 I will start warning and naming people. I apologize to the member. You may ask your question again.
This government has.
The Minister of Education will come to order. The minister, or rather the member from Windsor West, will come to order. I will start warning people. The member or the Minister of Education is warned. Please re-ask your question.
This government has had 7 years. They keep bringing up the past Liberal government, and it's a good thing we live in their heads rent-free, because after they canceled rent control, rent has gone through the roof. So I'm a nurse. I've worked in long-term care. The story I shared with you, that should have touched a nerve, and you should be that passionate about fixing our broken healthcare system.
Show some respect.
This is what our system has become for too many people. This is not a place of healing, but a place of fear, delay, and despair. Hospitals are stretched to the point where hallways have become permanent patient rooms, and families are left wondering if the care will come in time. So I encourage this government to talk to nurses, talk to PSWs, talk to patients about what they're actually seeing on the ground. So, Speaker, through you, to the minister, how can this minister continue saying our system is world-class instead of doing her job to fix it?
I recognize the Minister of Education.
Well, Madam Speaker, talking about a lot of words, right? Talk about a lot of words. For 15 years, that's all the Liberals did. a lot
The Liberals
of
will
words,
come to
right?
order.
He talks about long-term care. The member talks about long-term care. We inherited a long-term care system that had not been reinvested in over 15
Liberals will come
years.
to order.
The responsibility for the failures of the healthcare system, including long-term care, stand at the feet of the Liberals who abandoned healthcare for 15 years.
Member for Windsor West will
They
come
put
to
our
order.
seniors in ward rooms, 4 people packed to a room. That's your legacy. They fired nurses. That's your legacy. They've made our seniors 2 hours of care a day. That's your legacy. We're building more. We're hiring more.